Hi Putri, thank you so much for joining us today in this interview series organized by the International Health Economics Association, ECR Special Interest Group. And thanks to International Health Economics Association also for having me interviewing you. It's my pleasure. And I'm really, really happy to be here today chatting with you. This series of interviews aims to explore different career paths in health economics and to provide an overview of the variety of topics and areas where health economics seats apply. So you have a really impressive career trajectory spanning academia and policy engagement, and you are currently a Fulbright scholar. Some of your research interests include health financing and public health program design. Can you tell us just a little bit more about yourself and your career, and how did you get interested in health economics, and what was your path to get there?
Yeah, thank you so much, Clara. Well, I have like a public health background allowed. I graduate from bachelor degree in public health, and then I continue to get my master in health administration. And then currently I'm pursuing PhD in international health and sustainable development. So currently I'm still working as assistant professor in Faculty of Public Health, Universitas Airlangga in Indonesia. And what I became interested in health economic is when back to my internship during bachelor degree, we did community empowerment, and we share our idea to the community leader. But the one that we get at the first time is like they ask us how much it will cost and how much they will get back from this community empowerment. So at that point, I'm thinking like, oh, I need to have like skill to calculate something to share it to the policy makers. Yeah.
So basically, you were already involved in public health, and there was some questions about, okay, but what is the return on investment, and how much is it going to cost, and what are the benefits that are going to be derived? Yeah, I think
like even they are the like general population, not always like the high impact policymaker. They ask me like that.
So it's not only policymakers, but also you think among the population that now these questions are coming up.
Yeah, that's correct.
And do you think that there has been an increase in interest in the last few years versus when you started in public health towards health economics?
Yeah, I think like health economics become like very interesting things in Indonesia right now. After we have implement national health insurance in 2014, since 2014, like I think everyone talk about health financing, and then currently they talk about health technology assessment to make sure that this national health insurance system will be sustainable in the future.
So health technology assessment is kind of new then in Indonesia?
Yeah, because like I know some of my colleagues work in this area, but I'm not sure that it becomes so popular right like currently. And like I know last year our Ministry of Health like they established new center for only for health technology assessment. So yes, just to make sure that the national health insurance will be sustainable.
That's really, really interesting. And it's good to hear that more and more countries are implementing health technology assessment and thinking about health economics for public health. So you started your career in Indonesia, but now you are in the United States doing a PhD. Can you tell us a little bit more about the institution that you're in, and what are the challenges, but also what are the good things that you get from doing a PhD in a different country?
Yeah, like I graduated from my master like 10 years ago in 2012, and then I'm started my career in academia in Indonesia. And then after 10 years, I got scholarship finally after like a long journey to find the scholarship. And currently, I got Fulbright scholarship in Tulane University in International Health and Sustainable Development Department, where in this department they talk a lot about how to make to make the health program sustainable in different perspective, not only in like health management, but also like health economics. And like also the interesting one is like I'm very amazed that like gender equality, sustainable social inclusion and disability, like it's kind of like very great issue here, that how they can incorporate in public health and preventive programs to make sure that it will be sustained in the future and all of people can get benefit from the this kind of program.
Mm.
Yes.
So your research right now is maybe a little bit more focused on that sustainability of healthcare systems.
Yeah. I'm planning to take like more like GEDSI approach in public health programs, but I also thinking to make it like I have to relate with what I learned previously on national health insurance and also like health economics. And I just know that there is like association talk about the economics, the feminist economics. So it's not only to talk about the how the payment system or how the health financing, but also how like individual in the household can make a progress for the economics.
And do you see that there is a different approach, for example, in Tulane University versus the research that you were doing in Indonesia? What are like the common, I guess, views or approaches and those that are different?
Yeah, like I know health system strengthening is like it's like an issue like globally talk about, like Indonesia we talk about that also, and the US also, that it's also happening here. But I think like working with and studying with other colleagues with different cultural background, like it's like very beneficial for me. Like I know how they see global health with different perspective. And then I know also like many of the professor in department talk about discrimination, and then talk about the gender equality, like something like that, and they try to integrate in their analysis. And like it's kind of approach that I don't get much in Indonesia, because like when I first time share my idea in Indonesia to my colleagues in Indonesia that I want to learn GEDSI feminist economics, they think, is that important? Like the most important, like how to make the system efficient, like how to make the system effective. Like that sort of things different here.
But that's really great then that you're kind of have the opportunity to explore all these different views as well, and maybe also explore the different relevance of these different approaches. So that's fantastic to hear. And I guess as someone with such global experience and global exposure, and you have had contributions as a WHO fellow, and you have also been a ThinkWell Global Fellow, which is a think tank for global health. How do you think that these experiences have shaping your perspectives of the challenges that we have right now? And what lessons from these specific experiences do you hope to bring back to your work?
Yeah, I did some fellowship during my 10-year gap before the PhD, because I think like I need like more perspective in health system and health economics. So I think like different fellowship brings different experience for me. For instance, like a fellowship with WHO-SEARO, they talk about gender intersectionality in health system. Like this kind of like very new things for me, and like never knew before, like how genders also matters in the health system. And I learned a lot in that fellowship. And then with ThinkWell Global, I really appreciate that I can learn more about how health financing works in global health. I learn about system payment system. And the one that I appreciate also is like during my fellowship with ThinkWell, they teach me about science, communication science. So like how to create the project at the beginning. So after the finalizing the project, I can share what is meaningful to different population, like policymaker. What should you talk with them, or like what you should talk with the population to make sure that they will follow your program, like that. Yeah, science communication is very meaningful, and I got it from the last fellowship with ThinkWell.
Yeah. So I think that really speaks, because I think you have also said before that one of your goals is to communicate health system issues to the public and to engage them more efficiently. What are some of the key challenges that you think that we have right now in translating health system issues or complex research findings in health economics or in healthcare systems into actionable policies and into something that the public can get on with or understand in a way that is meaningful for their own lives?
Yeah, because I think like the communication gap is because like they talk in very different language and different procedure. Like policymaker, they talk about the procedure, about how the program should be implemented based on the government things. And then for the researchers, like they always think about how to publish after doing the research. But then when we talk about the program to general population, they just think like, what is that will be beneficial for us or not? Like, yeah, like that's kind of the challenge that I think very interesting to address. And
Yes, it's kind of
yeah.
like the problem is translating maybe between perspectives and between aims of the different stakeholders. So academia obviously have some goals, policymakers have their own goals and their own view of the world, and the public has a different view. So the challenge, I guess, is to wave all those in together so they make a cohesive policy. Do you enjoy communicating with the public?
Yeah, I enjoy, but it's very difficult. Like I did a project during the COVID pandemic on science communication, but it's very hard to like make people interest with what with the message that we want to share, because
Yeah.
they want like simple language but like impactful things. And yeah, I think like health economics can very helpful for that, like showing if you go to vaccinate you can save your life like for how many years. Like it's very interesting to do health economics and integrate them in the science communication.
Yeah, I guess that in a way everyone thinks in economics terms in their own lives, right? Like we all make choices every day about what we do with everything, really, with our health, with our free time. So I guess that maybe a public audience will be more open to those concepts as well. Um, Next, I wanted to ask you, because you found the Airlangga, I think I pronounced it right, Airlangga
Yeah.
Center for Health Policy. Uh, you are one of the founders, which is a remarkable achievement. What leadership lessons have you learned from this initiative, and how do you see the Center for Health Policy evolving in the future?
Well, like this initiative is like come from me and my other colleagues, like because most of them are early career researchers, like most of them like still master degree, and we're still new in the health system research. But then we know that there is only limited opportunity for us like early career researchers to get like funding on health system research, because most of the opportunity always see the seniority of the PI, or also like the experience that they have. So the one that we want to do with this collaboration is like we want to have strong networking with each other and find something new on the health system issue, like maybe like the last project we did is like about crowdfunding for
Mhm.
healthcare. I think it's very interesting topic for like the Gen Z or millennial population, but it's not always become like interesting for policymaker that's still like in the different
Yes.
population.
Again,
So
very different perspectives and
yeah,
aims. Yeah.
that's why we want to have like this research group become like collaboration between early career researchers, not only for empowering each other to work side by side and to develop together, but also share like there is another issue like we want
Yeah.
to propose to
Yeah.
population.
I think that's a fantastic initiative to just get together and say, look, let's empower each other, let's collaborate, and also let's find issues that we all find that we should be tackling in research. And maybe also because you bring different perspectives and different experiences and expertise, you can tackle the problem from different angles, which is obviously always way more interesting than narrowing it down. Um, I think finally, my final question is about your role as editor-in-chief. And you have probably mentored many students and colleagues, and you have a long or a lot of experience in publishing. What advice do you have to young researchers aspiring to contribute to public health, health economics, and health policy?
Mhm. I think like we need to, as like early career researchers, the most important thing is like take all of the opportunity that you can achieve. Like there is a lot of opportunity there, and you need to take that, even though you think you only have a little chance to get this opportunity, but you need to try that. Like the fellowship, the first time I think like the fellowship is important, I also think that can I get that, because like there is another candidate for that, but we need to try just to make sure that you do not miss the opportunity, because with the opportunity I can meet many great person, great mentor that help me then to develop myself and what should I do next for my career. Yeah, so I think like the one that I want to share with my student is like take all of the opportunity, don't be afraid, and just be confident. Not because like you are from the global south you cannot get that, but
Yeah,
you still have the competition and have opportunity to win the competition.
I think that's really, really like empowering to hear you say that, just to go for it, give it a try. And I feel also because many of early career researchers are, or they come from, and they are used to Excel, they are used to, doing well on their own. So I think another thing for me, at least, it was important to also know, okay, I want this opportunity. I'm going to reach out for help to learn how to prepare the best. And I think that is something that many people don't realize, that you actually can reach out and help. And most of the times people are really happy to give a hand or to give advice. uh, do you have any experiences as well in mentoring or helping others, or do you have any good experiences with mentors that have been important to you?
Yeah, like I have like special person. Dr. Karen Gravin is very great person for me. I never meet her actually, but I know her in like mentorship programs, and she helps me a lot on how to not only teach me on analytical skills on how to analyze the data, writing a manuscript, but also makes me like boost my confidence that, oh, actually I can also work with other colleagues not from Indonesia and never met me before. Like, yeah, that's the most important things for me during the mentorship. So yeah.
That's fantastic. And it's so good to hear that now yourself are being the mentor for others. I know that that will be like really important for so many people.
So,
Well, thank you so much, Putri. It was an absolute pleasure to discuss with you today and to just get a glimpse on what you do in health economics and in your research and to learn from your career path, which, as I said before, is really, really impressive and you're making such a good impact. Thank you so much for being with us and have a fantastic day and best of luck with all your research.
great. Thank you so much, Clara.
No worries, Putri. Okay, I think we can close it here. So we will cut it here. How do you feel?
Okay, I hope like it's quite helpful for everyone.
I think so. Look, I mean, for me, I remember it was so important to just have the stories of other people to understand like what you know, like you don't have to follow a straight path. Like sometimes we only see people that have followed a very straight path. So they finished university and immediately they did a PhD and immediately these other things happen. And I think it's so important to portray stories like you work for government, you work for policy, you did all these things before doing your PhD. And I think in a way, like early career research doesn't really apply because you have had so much experience. It's only like, okay, you like haven't finished your like PhD degree, but you basically have all the work experience. And I don't know, I think it's important to highlight that to people that no matter where they are right now, they can get to other places.
I'm so helpful.
Yes. Well, thank you so much for your time. I don't want to take any more of your time. I know that you must be very busy with all the snow.
You with the kid, actually. Oh, I should mention that, like women and kids during the research. Yeah.
Do you want to?
Oh, you want me to talk about that?
If you want to, yes.
If you think it's very helpful, I can talk about that. Like,
I mean,
but
up to you. If it's something that you want to, that you feel strongly about, we can add another question and then we can try to put it in.
I'm not sure. I'm not sure. Like, I just only have one son, so there is another person that more burden than me.
Yes, yes. I was with a friend the other day and she has 3 kids.
Yeah.
Yes, so the house was interesting. Well, yes, and then I will let you to enjoy the evening with your son. Thank you so much again for doing this with us. We will be in touch. I think they will send us the recording probably in the next couple of days. I will edit it to cut the beginning and the end, and then I will send it to you to see if you're happy with it and to put it online. And please use it, promote it as much as possible for you as well to, you know, if you can use it for your own profile and for visibility, please do.
Great. Thank you so much.
Thank you so much, Putri. It was a pleasure to meet you as well.
Me too.
Maybe we will see each other in some conference or something.
Yeah, hope so in AHEA in Bali.
I don't know about AHEA this year. It's difficult for me. But I'm gonna try for HTA International maybe.
Let me know if you
Yeah.
go to the US.
Oh yeah, the US this year is difficult. We'll see. I don't know. From Australia, everything is far away.
Yeah, let me see in Bali in Indonesia.
Oh, like that's what I thought. Oh, Bali is perfect, but the dates don't work for me this year. So. Maybe next time.
Sure.
Well, I hope to see you around.
Yep. Thank
Thank
you
you,
so
Putri.
much.
Thank you so much. Ciao, ciao.